Nurse practitioners and physician assistants are simply physician extenders. It's another tool in the arsenal to replace the reducing number of urologists, the increasing patient population, and it's a necessity.
Christian R. Patno, a principal at McCarthy, Lebit, Crystal, and Liffman in Cleveland, Ohio, has represented patients and doctors in many lawsuits.
Where I've seen fallout is physicians who try to utilize the physician extenders to help increase the profit of their practice or to cover the office, say 4 days while they're in doing surgery, and the doc's so busy doing surgery that they're not providing good oversight, and patient volume is causing patients to slip through the cracks with the extenders. I've also seen situations where the insurance and the insurance needs are not being met for the doctor and the PA in the practice simply because the insurance coverage is based on the old practice model and doesn't take into consideration the unique risks of the new practice model, especially if a physician extender leaves and then a lawsuit's filed.
When patients do slip through the cracks, as Patno mentioned, that's when Todd Rodriguez, a partner and co-chair of Healthcare Law Group at Fox Rothschild in Exton, PA, says liability risk increases.
Terminology often used in professional liability cases is the captain of the ship. The physician, when treating a patient, is generally deemed to be the captain of the ship, and those folks under his supervision can create, liability for the physician. So obviously, the more people the physician delegates work to, the greater that sort of sphere of potential liability gets. On the other hand, physicians, generally speaking, are required by state law to maintain professional liability insurance. In many instances, extenders such as PAs and nurse practitioners may be required by their state law to also maintain professional liability insurance. If they're not required to maintain professional liability insurance, they may still be able to buy professional liability insurance for those folks. And then if they're acting under the supervision of a supervising physician, that supervising physician's professional liability insurance may cover the acts of the PAs and nurse practitioners.
And if you're using a nurse practitioner or physician assistant, Patno and Rodriguez say it's important to keep this in mind.
The standards of care vary based upon the duties and responsibilities, so I'd like to make that clear distinction. But the standard of care in a urologic practice is always the same, no matter who is providing it. A patient should have the comfort of knowing when they walk in, they're going to be treated as if the doctor knows about everything that's going on with their care and treatment. The doctor must then rely upon the nurse practitioner and the physician assistant. If they don't tell the doctor something, all right, the doctor then doesn't have direct negligence, but they could have respondeat superior negligence for hiring poorly, supervising poorly, training poorly. So the ultimate issues from two sides end up going upstream to the doctor.
In my experience, the likelihood of being sued for some malpractice has much more to do with the individual involved than it does with whether they're an extender or a physician, for example. And by that, I mean that, there is some evidence out there that patients are more likely to sue when a practitioner has a bad bedside manner. If you have a good personal relationship with your patient, they're less likely to sue. Obviously, if you're not a good clinician, there's a greater likelihood that you're going to get sued. And that's an individual thing. It doesn't have anything to do with the fact that, you're an extender or a physician.
Patno and Rodriguez recognize that liability is a legitimate concern, but offer some advice on how to limit it.
So it's just doing what you were trained to do from med school on forward. Do your job. If you do your job and you do your due diligence, and I know it's getting much more complicated with all these policies, procedures, reimbursements, and all the headaches that exist, but the patient care and your duties as a professional are utmost. Medicine is constantly evolving and changing. Physician extenders and their addition to the practice are just one more new change. It's nothing to lose sleep over. It's nothing to be fearful of, but it is something that has to be acknowledged, accepted, and addressed. And if it is everything will be fine and your practice will be fine.
And they won't see you in the courtroom.
And they hopefully will never see me in a courtroom.
If you're a physician and you're seeing patients, you walk around every single day with that liability risk because, they call it the practice of medicine because you're practicing. It's not perfected. And so anybody could have a malpractice suit. And I've heard many physicians over the years say, everybody gets sued at some point, and it's going to happen at some point. So you don't have, you have some control over that in that, you practice good medicine, you document well, you have good communications with your patients, et cetera. One, you practice good medicine, and two, you have insurance. So, one of the key things you can do is make sure that you have good corporate coverage and you have good individual malpractice coverage. And if you can have coverage on your extenders, you get that coverage.